Bacterial meningitis. Bacterial meningitis is primarily caused by three types of bacteria: Neisseria meningitidis, Streptococcus pneumoniae, and Haemophilus influenzae. Each of these bacteria can lead to serious infections of the membranes covering the brain and spinal cord, resulting in meningitis. These bacteria are classified as cocci, characterized by their spherical shape. They are part of the normal flora of the human respiratory tract, but can become pathogenic under certain conditions. Unlike viruses or protozoa, these bacteria are prokaryotic organisms, meaning they lack a defined nucleus. One of the bacteria, Streptococcus pneumoniae, is considered a gram-positive bacteria, meaning this bacteria has thick cell walls that help protect it from antibiotics and other substances that could damage them. It is also a facultative anaerobic bacteria, meaning it can survive in the presence or absence of molecular oxygen. Life cycle and transmission. The bacteria typically colonize in the nasopharynx and can be transmitted from person to person through respiratory droplets. They do not have a complex life cycle and do not require other species for their survival, but their transmission is facilitated in crowded conditions such as dormitories or military barracks. The infection process in humans. Once in the human body, these bacteria can breach the mucosal barrier of the nasopharynx, enter the bloodstream, and reach the meninges. Here, they cause inflammation, leading to symptoms of meningitis. The bacteria's cell wall components, like endotoxins, play a key role in triggering inflammation. These bacteria reproduce through a process called binary fission. It is an asexual reproduction where the cell creates a copy or daughter cell of itself. Global impact and distribution. Bacterial meningitis is found worldwide with higher incidences in the meningitis belt of the sub-Saharan Africa. Environmental factors like dry, dusty conditions and social factors such as overcrowding and poor healthcare access contribute to its spread. Climate change and migration also influence its distribution. Historical insights. Bacterial meningitis has been recognized since the 16th century. Major epidemics have been documented, particularly with Neisseria meningitidis. The development of vaccines in the 20th century marked a significant milestone in controlling its spread. Annually, there are an estimated 1.2 million cases of bacterial meningitis worldwide, resulting in around 135,000 deaths. While vaccination programs have reduced its prevalence in many regions, it remains a significant health concern in areas with limited healthcare resources. From infection to symptoms. Symptoms of bacterial meningitis include sudden fever, headache, and stiff neck, often accompanied by nausea, vomiting, increased sensitivity to light, and altered mental status. If not treated promptly, it can lead to severe complications like brain damage, hearing loss, or learning disabilities. Human immune response and patient outcomes. The human immune system responds to infection by activating inflammatory pathways to fight the bacteria. Survivors may have long-term effects or disabilities. Some individuals can become carriers of the bacteria without showing symptoms and potentially spread the infection. Efforts to combat bacterial meningitis. Treatment primarily involves prompt administration of antibiotics. Vaccination against the three top bacteria is most effective preventative measure. Public health campaigns focus on vaccination and awareness. Colleges are requiring vaccination for this disease prior to living on campus. Cultures of cerebral spinal fluid of an affected person are used to determine the specific bacteria causing the disease. After determining the specific bacteria, the correct antibiotics are administered. The person is isolated during treatment, and identifying any persons that were in close contact with the infected within 7 days prior to treatment are then given prophylactic antibiotics. Advanced technologies and international efforts. Recent advances, including the development of more effective vaccines and genetic research for better understanding. International efforts led by organizations like the WHO focus on vaccination campaigns and improving healthcare infrastructure in vulnerable regions. Future prognosis for bacterial meningitis. With ongoing vaccination efforts and improved health care, the incidence of bacterial meningitis is expected to decline. However, challenges like antibiotic resistance and access to health care in low-income countries remain. Continuous monitoring and global cooperation are essential for its control. What you can do. Individuals can protect themselves by getting vaccinated and practicing good hygiene. To contribute to the fight against meningitis, support vaccination programs, donate to healthcare initiatives, and raise awareness about the disease and prevention methods. In conclusion, bacterial meningitis is a serious infectious disease that requires global attention and action. Through understanding its causes, transmission, and prevention, we can work towards reducing its impact worldwide. Continuous research, vaccination, and international cooperation are key to combating this disease.